This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Welcome back to the show. We are honored to have Craig Quaglia joining us here again, our LMT, Myofascial Trigger Point Therapist, and excited he's back to talk to us all about the work he's been doing for so many years. Based out of Forest Park, Illinois, really amazing the massage therapy he does. He is licensed and experienced, and let me have him do the honors of telling us just a little more about you before we dive into today's conversation.
Good morning from Chicago. I wish I could say it's a sunshiny day.
I
It's
know.
not.
I
It's
know.
November.
Yeah.
My name is Craig Quaglia, myofascial trigger point therapist, 39 years experience, worked in functional medicine, preventative medicine, plus still in private practice. Thank you very much. 6 clinics, had a great time working with MDs, naturopaths, chiropractors, social workers, psychologists. The whole point is holistic and a synergistic approach is important to success, and we apply it wherever we can. Was an instructor for 5 years. So let's start out. Today, this is one of the most requested shows out that the feedback came in asking for, fibromyalgia. This fibromyalgia drives everybody crazy. The person suffering from it, the person who has the people who are working with it. So about 10 days ago, I woke up a Saturday morning, snowstorm, a migraine headache, and an intense low front. In our business, this is the beginning of the fibromyalgia season, the intensity of it, or anybody for that matter with chronic pain. Of course, by Sunday, I was getting phone calls, to start helping people deal with that change. And the reason for that is the barometric pressure increases pain because it's very low. I worked at the Fibromyalgia Treatment Centers of America from 2001 to 2008, and thank God I did. It taught me about the multi-disciplinary holistic approach of doing things using all the various different therapists, social workers, PTs, etc. And unfortunately, there is no shortcuts with this one. This one, fibromyalgia, demands as much help and resources as we can possibly throw at it. So usually when somebody comes down with it, pain meds are used. When we were at the Fibromyalgia Center of America, they were used carefully along with nutritional counseling. I had journals to make sure people weren't eating inflammatory foods that would increase their pain. Of course, we had the manual therapies, the counselors. The reason fibromyalgia is a complex, it requires a team effort. It's very rare that you can deal with it on your own. There isn't a single treatment that works for every person with fibromyalgia, and every person reacts differently. So, Jill, you may have a friend who maybe she's in her late 30s, early 40s, balanced life, successful career, married, children, living the American dream. Suddenly, she has a mysterious pain pattern show up, possibly post-flu, car accident, a fall, emotional trauma, which she seemingly recovered. But in conversations with her, you begin to notice that she's having a harder and harder time. And this may lead her to, as it slowly worsens, this may lead her to go off to doctors. The doctor may prescribe a pain med, and still, in spite of that, and maybe trying other things that were suggested, she slides into a worsened pain pattern. She sees another doctor, then another. She doesn't quite get quality rest. So now she's in a cycle where she's not sleeping, the pain's getting worse. It impacts her job, her income, her family, her personal relationships, maybe her personal relationship with you. This may go on for a few months to years. And by that time, as the years go by, she may lose her job, her insurance, her resources, her marriage, her friends, all at a time that she needs all to use those things. And why? She's finally been diagnosed with fibromyalgia after eliminating other possible causes for her widespread pain. The quality of her life is changed forever. What does she do now? Where does she go? So research has indicated, especially since post-COVID, the number of fibromyalgia cases are going up, and we don't know where that's going to stop or land at the moment.
Mm-hmm.
4 to 10 million Americans suffer from fibromyalgia. It's activated, like I talked about above, chronic illness, and COVID is just one of the newer ones. We anticipate with the new flu epidemics coming down the road that's going to activate more people, osteoarthritis, depression, anxiety, irritable bowel syndrome, physical and emotional trauma, or a genetic predisposition. In clinic, we discovered that it ran in families. It wasn't unusual to have more than one person exhibiting those kind of things. While it affects women who are primarily 30 to 50 years old, individuals of all ages and backgrounds can develop fibromyalgia. And usually we know that we're seeing larger numbers of younger people and sometimes even men, although it's rare. And unfortunately for men, it's worse because it's considered a woman's disease or syndrome. It's not a disease, it's a syndrome, and makes it harder for them to get help. So what is fibromyalgia exactly? As I said, it's a syndrome,
Mm-hmm.
a chronic condition characterized by widespread musculoskeletal pain. And here's the key thing for me: accompanied by fatigue, sleep disruption, memory and mood issues, and it becomes self-perpetuating. And part of the reason for that is if you disrupt the sleep and you don't get proper rest, the healing process of your body begins to break down and causes problems. So fibromyalgia is a disorder that amplifies pain sensations affecting how the brain and spinal cord process pain signals. And the problem with it is the primary symptom is the pain becomes widespread. It's not just in a shoulder, it's not just in your lower back, it goes throughout the whole body. And it turns into a constant dull, aching, lasting for a minimum of 3 months. Often it goes on and becomes life-changing for the person suffering from it. One of the key factors is fatigue. Even after sleeping long periods, people may still feel tired. And there's a cognitive difficulty, something we call fibro fog, which means their ability to focus and have mental clarity and do anything becomes really, really difficult. So when I have, like on a day like today, somebody coming in, I have to be way more patient and allow them to work through so they can tell me what's going on. So it's a challenge right off the bat. Additional symptoms we talked about already. We talked about sleep disturbances, but not just even sleeping longer hours, but having it disrupted, not getting REM sleep, where your healing takes place. Headaches and migraines become a big part of this. In fact, there's a study that came out that showed that young women who have migraines early in their teens are more susceptible to fibromyalgia. So the deck is already stacked. Digestive disorders, another system begins to break down. Irritable bowel syndrome, leaky gut, candida is a big part of this. Mood changes. Of course, you're going to have mood changes, including depression and anxiety. Why wouldn't you be depressed and anxious when you don't understand what's happening to you? And unfortunately, when that happens, you really begin to start doubting yourself or what's going on with it. Sensitivity to temperature, light, and sound become a big problem. And we talked about one of the things that makes this difficult is how these symptoms that we just mentioned there, sensitivity to light and sound, also are for migraine headaches. So it confuses and makes it difficult to make a proper diagnosis. The exact cause is unknown. They don't understand it. They don't know. believed to involve a combination of genetic and environmental factors. So what do we mean by that? Factors that may trigger fibromyalgia include physical or emotional trauma. Physical trauma could be a fall, could be post-surgery recovery, emotional trauma, the loss of somebody, or PTSD. All these things play a role in making your body and your central nervous system hyperactive. Infections, post-COVID, we just mentioned, maybe post-surgery, an infection. I have somebody coming in today who is post-surgery for the hip and went through all kinds of things,
Wow.
who's fibromyalgia because of the infection, stress. Stress overwhelms our life, and most people don't do a good job of handling it or learning how to deal with it. And so what it does is it begins to wear your body systems down. And then we
Okay.
talked, yeah, that's crazy. That one's crazy. Genetics, a predisposition to it. And as testing goes or research goes on, they may get some more clarity about that. There is no specific test for fibromyalgia. It's a diagnosis that typically involves process of elimination by ruling out conditions, and this takes time and resources, and it frustrates the hell out of everybody involved. Evaluating symptoms based on a specific criteria and physical examination. There's no cure. And this is the part that drives everybody crazy too. Symptoms can be managed though. Once you know what's going on, you can begin the process of dealing with this and not be in this hopeless situation where you don't know what's going on. Often they start with medications, but in the clinics, we notice the patients, when they were started with medication, were often nutritionally depleted. This is why we did the food diary. This is why supplements were brought in. We needed to bring up because then we could reintroduce the drugs, and unfortunately, that's overlooked in a lot of places. Exercise and physical therapy and manual therapies sounds great. It's not easy. When you're doing exercise with somebody with fibromyalgia, a normal person like you, and when you think back to when you started running, you had soreness because you're using your muscles in a unique way, and then that passed over time. Well, in this case, fibromyalgia people do everything they can to protect themselves from not having to do anything that's going to increase pain. So you have to deal with that. Physical therapy, manual therapies, massage therapy, myofascial trigger point therapy, release, relaxation techniques. Once you could find the right ones for the individual, stress management, breathing exercise, meditation, yoga, tai chi. Finding the best one for that person takes time. And then you got to sell them on the idea and show them over time the results that they can get. But this allows them to take control. Cognitive therapy. When you've been told you're crazy or you're feeling invalidated, you begin to have negative feelings about yourself. And so this is when we bring in social workers, psychologists, support groups. I'm very careful about recommending support groups in general because sometimes they're run by hospitals and they won't allow people to really say things the way they want to say them. Lifestyle changes. We talked about improved sleep habits. Healthy diet is definitely key. You don't want to eat food that are high in sugars that are going to increase inflammation, that kind of stuff. Self-care techniques empower fibromyalgia sufferers to manage pain for life. And when you can see and get a situation where you can develop this and see the light go on in their life, in their eyes, and their life begin to change, that's when things really start to happen. So there's a classification for this. The central nervous system amplifies sensory input across many organs and systems. We've already talked about the cognitive. We've talked about the musculoskeletal. We're touching on all these. It's not a one system problem. It's a whole entire body problem. The cost and impact to the individual, especially if they lose their insurance, lose their job, direct medical expenses, medication costs, therapy sessions, indirect costs like loss of income and reduced quality of life, worse, isolation and invalidation at a time they really need all these things at that point. And it's sad. to the economy, increased healthcare utilization, and lost productivity. Why? Because it takes so long to find out what's going on. Significant resources used for diagnosis, treatment, and ongoing management. The more I can teach that person how to take care of themselves, the less they need to depend on a system that's draining them financially. Onset, for some, it's gradual. Maybe it never becomes really as bad as we have mentioned here. For some, they sort of fall in the middle where it gets really bad, and then they find a middle ground where they can function okay. Maybe occasionally something happens when they get sick, but there's a significant number of people where they're in it all the time, 24 hours a day. It's impacting them on every level. Some people experience rapid onset for any number of reasons. Others do it as a result of physical trauma, surgery, infection, they're surprised. All right. And as we said before, it's more common in women than men, and the average age it strikes is at 40. What's going on in fibromyalgia? So we're going to simplify this a little bit more, okay? What's going on is the brain and nervous system overreact. There's sensitivity in the brain and spinal cord to pain signals. Even normal touches, light touch, a cool breeze, can set off and increase the pain because the nervous system is so exaggerated in its pain responses. Pain control isn't working well. Your body's natural ability to reduce it has been short-circuited. The biochemicals that you need aren't available, or they're weak. Your ability, that this allows it to run down and making the pain worse. So we're in a whole different system now, biohormonal. The pain signals have too much of a kick. You over response. Something like substance P, which is a modulator, are higher than they should be, making the nerves more easily activated and more sensitive. That's not a good place to be. Muscles, trigger points are activated. People who are in fibromyalgia begin to be mummy-like or Frankenstein-like. They don't want to move beyond the point of turning or being in pain. And so that really starts to lay down trigger points throughout the body. They have poor blood flow. They release substances that actually cause more pain and inflammation. Muscles stay contracted and tender, especially tender, contributing to ongoing pain. Inflammation and immune system becomes involved. Another system now. There are small amounts of inflammation in the system. Just a little bit can make nerves and muscles more sensitive. The ongoing low-level inflammation keeps the pain going. So you're sort of in your own pain spasm, pain cycle at that point. So this is why the synergistic or holistic approach is very important. And one of the cornerstones is where I play a role is in the manual therapies. This includes myofascial trigger point therapy, massage therapy, myofascial release. They're all interconnected approaches. And they're done in such a way that we literally get permission from the body. We want to start working with all the different systems. And the first one you work with is the spinal cord and then the brain, where the pain is being interpreted. So we use we start out by, at least in my case, I start out with identifying the areas that are the worst. There's always areas that are more active than others. So I find and I start looking around for the hyper-irritable points, the trigger points, and then releasing these points and tenderness and causing the different spasms, the pain spasms, pain cycle. Because when you're in a pain spasm, pain cycle, it's circular. It makes the pain, increases the spasm, which increases the pain. We want to break that. And when we can, the body goes, oh, this is what it feels like to be normal again or to be relaxed. And more importantly, it begins to offer hope to the person that's going through it. So we want to really break that and significantly reduce pain. So how do I do that? I start out with massage therapy.
Okay.
And sometimes it's a feather touch that I have to use. I can't go in hard and heavy. I have to listen it. I have to look at it as a conversation with the central nervous system and the brain. I have to get permission And so what I do is I slowly begin the process of releasing muscles, the fascia, relieving the tension and stiffness that is really, and stress that are really common in fibromyalgia. I begin to promote circulation, maybe aiding in toxin removal. Um, Certainly starting to facilitate muscle recovery on the area that I'm working on. It also improves move. Okay, now we're back into another system. By increasing mood, you have hope again. You have the ability to begin to learn to intervene in what's going on. Sleep quality increases better, reduces anxiety, enhances overall well-being. There's hope again. Myofascial release is a gentle manual technique that I use targeting fascia restrictions. Now we're, instead of being in one section of the body, I'm starting to pay attention to lines of connective tissue in the body. The connective tissue surrounding the muscles and organs, restoring fascial and flexibility. Remember what we talked about a minute ago or two was the ability not to be Frankenstein-like anymore, a mummy, getting back to full range of motion, being able to move. Movement is important. Restoring the normal patterns that are important. These effects reduce strain, fatigue, hypersensitivity, contributing to the better sleep. We're back to sleep again. Reduce discomfort. Better sleep, less pain. Myofascial trigger point therapy focuses on identifying and deactivating those trigger points, type sensitive. So that what that means is I'm going in deeper now. I've had permission. I can go after things that are activating and stop them from reactivating. This alleviates muscle pain, tenderness, again, spasm. Improving blood flow, supports healing, well-being, breaks up the pain spasm pain cycle, and again, taking it to another level of reducing pain. The therapies target peripheral pain sources, starting at the skin and moving down into the trigger points and fascial structures, deeper into the body. They are most effective when they're combined with all the other techniques that we talked about and bring in the team, the holistic team. They reduce substance P. It gets to start to react normally, modulating the pain and leading to decreased inflammation and pain. It also creates something your body needs, and the most important painkiller that your body could ever have is endorphins. When it does that, then the other ones begin to come into balance. Cortisol, norepinephrine. Again, we're improving mood and reducing anxiety. So by deactivating the trigger points, the adhesions, we're reducing the hypersensitivity in the nervous system. We're rebalancing hormones. We're creating therapies and helping to normalize muscle activity and to create pain relief while impacting system after system of the body. More importantly, the key thing, this is a thing that really excites people like me who are therapists like this, that we offer hope for a more normal life by teaching people how to do a lot of this for themselves. And that's really where it's at, because if you've lost your job, even if you have your job, getting into seeing doctors, finding a holistic team really become challenging. So the more I can teach you to do and for yourself and take control, that changes your life. That gives it back to you. That doesn't mean you're going to get rid of fibromyalgia. What that means is you're going to be able to manage it and have a quality of life that you don't have now. So if somebody out there is looking for information about it, yes, the American Fibromyalgia Syndrome Association online is a great place to start. It is a tremendous resource. It has great stories. It explains things in layman terms to people who without hope can now find hope and start to take control of their life and not be on a cold, dreary day just going down and going to bed, and God knows how long that will go on. So, but this is the one that drives everybody crazy because there's so little we understand about it, but yet it affects every system of the body. So you have to deal with every system of the body.
Got it.
And okay,
Well, thank you.
you're welcome.
And how can we contact you? That was a lot. That's great.
Yes, but this one was important. CraigQuagliaTriggerPointExpert.com, 708-524-8812. And we got through this without something going wrong today. Yeah.
Yay! You did great. Thank you for all the information and all. You have been on an amazing platform and podium today speaking. And boy, oh boy, what a great job. Thank you for engaging us like this and for doing what you do. How can we contact you?
I gave that already. And it's CraigQuagliaTriggerPointExpert.com, 708-524-8812. And you have a good day.
You too, sweetheart.
Happy Thanksgiving, by the way.
You too.
I don't
Happy
think we're
Thanksgiving.
on.
No, I guess not.
Yeah.
So I'll see you the week after.
Oh, we
Enjoy.
got a day off. Oh my God.
Yay!
Oh, yay.
Enjoy, sweetheart.
Take care.
Thank you.
Okay. Bye-bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.